Welcome back to Cool and Chronic with me, Simone. Today's guest is going to be opening up about her journey with PCOS and endometriosis. Also, the difficult decision of having her recent hysterectomy after years of trying many different treatments. We're going to be talking about surgery, recovery, and the advice she wishes she's had sooner. So, everybody, please welcome the lovely Helen. Hello.
Hello.
So if you wouldn't mind just giving a brief intro of where you're from, your age, and then we're going to get into the main questions, but give a little intro.
Yeah, of course. So I am from Wombourne,
Yes.
which is a little village, kind of just outside Wolverhampton. It's classed as Staffordshire, but it's not that posh. People think it's posh. It's not posh. Some people call it Wombourne. But
Yeah, Wombourne.
Wombourne. But yeah, so I'm from Wombourne.
Yes.
46 years old, and I've got two children, although they are grown up now. So Taylor is 21, that's my son, and Evie is 15.
Wow.
My daughter.
And it's amazing because we were just having a little chat, like, with Helen, she's gone through the whole journey of basically someone's life journey with endometriosis you've gone through, to be honest, which is incredible. But we are going to start from the beginning because that's where we like to tell the story from. So if you could just go back, not many years. I would say Helen looked really young, by the way, if you can see her on the video. She does not look 46, but we're going to go right back because you have actually been diagnosed for, I believe, did you say 20 years with PCOS?
Yeah.
And then the endo. So we're going to go from the very beginning and we're just going to talk about how your symptoms sort of manifested, and let's go for it. Go for it.
Yeah. Okay, fabulous. So when I very first started my periods, I think I was like just around 12, 11, maybe late 11, early 12. I started my periods.
Yes.
And very, very, very soon after starting my periods, especially for a young girl, I suffered like severe pain, very, very heavy bleeding. Where I had to miss PE a lot at school. I'd remember that my granddad used to have to come and pick me up from school all the time, so I was really, really poorly. In pain. And my mom, there used to be a little health shop in the village called Nutmeg, and my mom used to go there to start with to try and get me like just herbal remedies to try and help. So we tried that because I was so young, and it didn't help at all. Went to the doctors, and to start with, it was very much, as I think probably most women who suffer can relate, oh, it's just bad periods, it will get better, or she'll grow out of it, or just deal with it, basically. But then it got to a stage, like after a couple of years, where it would be so heavy. Like my mum, bless her, was always washing my bed sheets. It was just, and I'd wake up in the middle of the night, I'd be in agony, and I just used to think, which I've throughout like the whole process, well, perhaps that's just normal. That's just how it is. But then it got to a point where it was like unmanageable, and I think I was probably coming up to maybe 13, 14, and went to the doctors, and the only thing that they could then say, which was the remedy for acne and hormonal issues for boys and girls, well, not for boys, but they used to do something else for boys, but was to put me on the contraceptive pill.
Yes.
So I was really young going on that. Yeah, which I look back now and I think that in itself is possibly a cause. It was like masking it, and it helped. It at the time, it helped. And then for years I didn't, other than the odd time, I didn't really suffer. So it made my periods regular, and I didn't really get too much pain.
So what pill did they put you on?
To start with, I think it was called Celeste.
Yes. Like a yellow, isn't it? I think like the packaging or something. I can't remember that.
I think so. I've had them all. But I've been on them all. But yeah, I think the very first one was possibly
that one.
Celeste pill.
And did you have a break? So I know some of them I always put on one where you don't have a break in that time, like you just have the pill and you continuously don't have the 1 week break to have the period. Were you having the period?
So yeah, I'd have that week break, and
Yes.
in that time I'd have my period. But it was great because you just
Normal.
knew exactly where
You
you
could
are with it. Yeah,
prepare with it. Yeah, I
yeah.
get
So
that.
it was they still weren't amazing, but I don't
No,
think periods are anyway.
no, who wants them? No one.
No, but
Yeah,
it was so much better. So and then there was no
money.
like knock-on effects with school, and that was all fine.
You
And
could live your life at that age. Because
yeah, and holidays as well. And I look back now and I just think I was so young, and you don't want to dramatize it, but I just think, oh my God, like that was a lot at that age
I was
to
about to say
be going
that.
through that.
And you're going into secondary school, I believe, at that age. Or are you in secondary
I
school?
was in secondary school, but I think now, like, that's the age that Evie is. So I really
You can compare with
relate.
your daughter and be like,
Yeah,
and imagine like how your mum must have felt. And obviously it isn't that long ago, but endometriosis was not a thing really back then. It's like really coming into the forefront now, and there's
yeah,
loads of like progress with it because people understand how disabling it is, because it is classed as a chronic illness and
yeah.
disability. But back then, I bet you didn't even know any of well, you didn't know what you had then,
No,
sorry, but no one ever heard of it, so I bet it was really confusing.
yeah. I think as well that, and I'm not knocking that this was like the solution at the time,
No.
but there wasn't any like, and I'm glad, because it would have been really intrusive that young, but there wasn't any investigation as to why. It was just have this and you'll feel better, not let's sort the reason out why there's a
Yeah,
problem.
let's mask it. It is
Yeah,
it is a masking technique, isn't it?
yeah,
They say like it's actually not, but it helped you get through your teenage
yeah,
years. Incredible.
absolutely. So it got through the teenage years, remained on the pill until I got married, wanted a baby,
Yes.
and came off the pill, got pregnant straight away with Taylor. So there
Wow,
wasn't, I know, so
that's
there
incredible.
wasn't a break. I didn't
No.
have a time of not being on the pill because I was
Ah,
pregnant straight away. So I didn't, other than that first period when I like stopped the pill, I
yeah.
didn't have that break. So I still, even then, I didn't really know there was a problem.
Because it's still in your. We were discussing it. I believe the pill stays in your system for like and we're not medical professionals, but an X amount of time. So
Yeah,
obviously you wouldn't have really had your body's not managed to adjust to go back to a normal setting, shall we say?
no, like a
It's still,
normal cycle.
yeah, it's still in your body. So you
Yeah,
then pregnant, and how was the pregnancy?
terrible.
Right. Okay.
So it was horrendous. The
Oh,
whole pregnancy. I listened to your podcast actually a couple of weeks ago with your friend that has it awful morning sickness. I can't think what that condition's called, but
HG is it? Yeah,
that's it.
HG.
Yeah,
Yeah, it
I
is.
listened to that and I thought, well, my heart went out to her because I had morning sickness
Yes.
for pretty much the whole of my pregnancy. I had a little bit of a break, but nothing to that extreme. So once I'd have the nausea every morning, I'd have the nausea and I'd be sick, and then it'd go away
You get
for
the
the
relief
day.
element
Yeah,
of it.
and she didn't get that relief from being sick, did she? She had that feeling the whole time.
Constant. I'd
So
hate that.
I was sick like twice a day with Taylor for the majority of my pregnancy, and
That's
then
also not normal though. Just
no,
so you know. And you went
no,
through it and you did it, like as in that's terrible. That's terrible. That is terrible.
horrendous.
Yeah.
Is worth it, bless him. But
Oh.
but so, and then the last like month or so, I had him 2 weeks early. The last month I was in hospital pretty much for that month with like high blood pressure. I was like verging on preeclampsia.
Yeah.
A couple of times they were going to do a cesarean, and then emergencies came in, so I didn't have the cesarean. Then my labour was like 38 hours with him. It was bad. I ended up in theatre. I mean, I can laugh
Traumatic.
about it now.
Yeah, that's
I was
like now you
traumatised for
can.
years.
That is terrible. Like
Yeah,
the traumatic side of it. That is,
yeah.
it's very traumatic, and you
Well,
also
it
had
was.
another child after that as well.
Yeah, I know. Well,
We'll
just
dive
about.
into that. Yeah. So did
So
so at this time when you're being sick and things like that, is that to you? Are you thinking, oh, this is just not like at the time? Is it like brushed off almost? And
yeah, I think that very much with anything like that, like female pregnancy periods, or you just think I've just got to get on with it. And a lot of the time, if you speak to doctors, it is like, well, that's just how it is. Just get on with it. So we are taught, and you know, strong women that you do
carry
just get
on.
on with it, don't you?
Absolutely. And I think also like looking at the generation of like our parents and things like that, they, like my nan always used to say, we never had none of that any treat no any sickness is no pregnancy is not an illness, sorry, she used to say.
Yeah.
And never had nothing. And it's true, they never had no
No.
help, nothing. And I think that breeds down then to our generation where you're like, right, suck it up, get on, because no one really understands. And you go and see a GP or something, not necessarily that I'm not shaming all GPs, but they don't really understand either, and
No.
especially at your time going through this, no one
Yeah,
would
and I
really
think
get it.
they also GPs have a very small amount of knowledge about a lot of things, don't they? They're not
Yes.
specialists in that area. So
No,
and
that's
this is
right.
what I've found, like with going forward, the problems that I've had. But yeah, so with Taylor, I had to have him via ventouse, which is where they have the little suction cap on the head.
Yes.
Sucked
Yeah,
him
pull them
out.
out. Oh
Yeah.
no way.
I didn't need, thankfully, a blood transfusion, but I was like on the verge of that. It was a horrendous situation. So yeah, it was just
Traumatic.
very, very, very traumatic. Then I was in hospital with him for a few days, and he wasn't a well little baby.
No.
But you got like and for years I used to kind of building up to his birthday, I'd like relive it. I'd real like PTSD from it,
It's
like
an
every
actual
day.
thing. It's
Yeah, I knew what was happening every day, like what had happened, and years. I mean, I don't know. He's 21.
yeah,
Um,
like, it's
but
PTSD. It's like
mm,
a lot of people and people listening. Birth trauma is very real, and it doesn't get spoken about because, again, you've got this beautiful child, so you should be grateful that you've got this. That's
yeah,
almost how I see it from the outside. And people are talking more about their birth stories now
mm,
and things like that. But imagine you are watching this, your body go through this, and I can only imagine a lot of people say like there's rushes of doctors coming in. That in
yeah,
itself is traumatic. Being in a
yeah.
hospital is vile. No one wants to be in a hospital. No one does. And then you're in there, and then you've got to stay in there for a day. And how old were you at this time? Sorry, Helen.
I had Taylor. I was quite young, I think now. So I had him when I was 25, but I was just 25. So he was born 6 days after my birthday. So I was like
Right.
24 for my
Yeah.
pregnancy. And I'd like done really well at work. So I was in a good full-time job. And I think that's the other thing, like from generations ago, the moms or pregnant moms or moms with the babies, they
Didn't.
didn't work, did they? So
No, didn't.
they could just, no, I'm not saying they just relaxed at home, but when you've got all that alongside a full-time job, it's a lot, isn't it?
A lot of people, and I think especially even more now, people listening to this, there are a lot of moms who I've spoke to as clients, they're forced to go back to work earlier because of the
Yeah,
pain. Like so people listening will resonate with that, because you are an almost baby is coming secondary to work, house. Like we've got
yeah,
a lot more, and like when I've had therapy and stuff, we've got a lot more external stresses nowadays, and it doesn't
yeah.
mean woe is us as the generation. I don't mean
No,
that, but we've got more threats, more, our bodies are living in a constant fear of like trauma and things like that. It's very real at the moment, with you can find anything on your phone, you can, connect, which is brilliant, by the way, because people listening, they can find this story and they can resonate with it and hopefully take your courage that you've been through and be like, yeah, but reliving it, that's something that's very real. And I can imagine it's only taken till now for you to not relive that story, or maybe when you had it, because
so there was like it was a much different story with my thankfully my pregnancy with Evie.
Oh, good.
But going back to like after I had Taylor, it was coming up to like his first birthday. He was between about 9 and 12 months, and I started experiencing like really severe pain and heavy bleeding. So I think I'd gone back on I mean, this is a long time ago, so I can't really remember, but I had gone back on the pill.
Yes.
And then, but I was still having, like, because I think I've been off the pill for such a long time, I then started like with the pains, this like dragging sensation. It's always all been on my left-hand side.
Right. And can you describe can you describe the pain to someone that's never had any period pains or of anything, or is it only in your uterus that you're getting it, or do you get it everywhere? Like, can you describe it?
So there's normal period pain, what I would call normal period pain, which is that like dull, aching, heavy, bloating, stomachache, bit nausea. Like that's to me, that's what I would say is a normal period pain.
Yes.
On top of that is the pain that I was having. It's slightly different at the first time, but it was very much like a kind of dragging pain. So I'd stand up. So imagine when you stand up and like the stretch between like your tummy and your pelvic area and your legs, it'd be like a kind of dragging and then like a shooting pain. And it wouldn't be all the time. It'd come in and out.
Like a
it was and I'd briefly gone to a new job, which was working evenings, which suited me because like with Taylor and going to nursery. So I was with him at home in the day while his dad was at work, and then I'd go out to work in the evening. But what was like, so I didn't enjoy that job, but that was a very like needs must job. But what came with that job was private healthcare. So I got to go to the the West Midlands Hospital, which is like Colligate, Halsowini way, because we lived that way. And I actually had a laparoscopy there. So 20 years ago, I had a laparoscopy there, and they saw like signs of endometriosis. But it's still, even then, it wasn't like it wasn't a big thing. It was just like, this is what it is. There was a bit there. It's gone. Done.
So you're on your way.
Yeah.
And is that, sorry, Helen, is that because you're getting the pains and you've gone to the GP, or you've just, so you've started that. If someone is experiencing the pains that you have spoke about and heavy bleeding, you go to the GP, I'm correct, right? You go to your GP, and then if it's private healthcare, they can send a recommendation for a
you get a referral.
You have
a referral, and then they...
What is that test, if you can describe that? I know, but for people that have never heard of I can't say it.
The laparoscopy.
That's the one, laparoscopy. What is that?
So it's like a keyhole procedure.
Yeah.
And they go in your tummy with a camera, and they so it sees more than like just a scan would see. So it's like it's through your tissues right into the organs, and they can see if there's like maybe fibroids or endometriosis or anything like that. It can diagnose, and it's not just for like gynae issues. I think through that procedure they can see like with your colon if there's an issue with that, or bladder, because it's all in that area.
Which is, so it's used as a tool for diagnosing a lot of things. But with endometriosis and say PCOS, they necessarily can't diagnose it with just a scan. Am I right in saying that they can't see everything on just a scan?
So PCOS they can't.
They can't.
Sorry, no,
Yeah, they
wrong.
can.
PCOS they can.
Yeah.
And it's very much your symptoms symptoms, and then it's the size of your ovaries as well.
Okay.
And like the little, they're called cysts, but they're not like, so it's called, well, it's not polycystic ovaries now, is it? But it's polycystic ovaries, but it's
Yeah.
like little sacks of water on your ovaries, so it's not like proper
Little grey.
cyst. Yeah,
Yes, I get you.
but it is little growths.
Yes.
So that can be diagnosed with an internal scan,
Yes.
and then so they can check the size of your ovaries, and it has to be a specific size, and then it is polycystic ovaries
For that.
for that. But then with endometriosis, that is, or was, purely via a laparoscopy. I think potentially an MRI as well.
Yeah, I think I have both. I think because a friend of mine has been going through a diagnosis, so I sort of know roughly a little bit about that as well. Yeah, I believe it's MRI, but again, she went private because I think the NHS doesn't offer these things willingly. You have to fight, and that is wrong. And as me and Helen have said, things are changing, which is positive, and we'll talk about that after. But so it's PMOS, we've learned. That's the new name, and endometriosis is actually they're doing some tests that you've read up about at the GP, aren't they, and stuff?
So there's some new technology out now. So because of that, the procedure that's required, the general diagnosis, and because then I've had this later on in life, they couldn't take that initial diagnosis from years. That wasn't even on record from after I had Taylor.
What?
So I had to go through it all again. And the average time in the UK for diagnosis of endometriosis is 10 years for women.
What the heck? That's
I know it's terrible, but
that's not right.
It is horrendous. But this new technology that's come out where they can do testing at the GP, I would imagine, I mean, I don't know how long I don't know when it's coming in, but it's something that's coming through now. But they are saying that it can be, there's tests, and I don't know what the tests are, whether it's blood tests or urine tests, I'm not sure, but at the GP, so that would be like weeks rather than
life changing. That is
it is life changing.
Because I mean, you've gone through your journey, and as we're only at the beginning here, like we're literally at the beginning, but I know people who have been, as you've just said, been diagnosed, they've then gone back, the endometriosis has gone, because obviously with your womb and things, I'm not a GP, but I know that it can get rid of things that are in there, because we bleed every month, so it's not like so some people, another friend was diagnosed, then she went in for a lamb's that I can't say, and she was told she didn't have it because it either come away or whatever. It's a growth. I will add some diagrams on the Spotify of what the best way to describe it. It's like a web, isn't it? It's like almost like a web that, like, if you can see it, like sticks and pulls things. And so you obviously you've gone through your lang blur at the private hospital, and they've said they think it looks like endometriosis. They think it wasn't a definite diagnosis there.
No, so they said they thought it looked like that. There was bits that, like the lining, because it's the lining of your womb that comes away and then attaches elsewhere, and it can be anywhere in your body. It the other thing I meant to say, I was getting nosebleeds when I was having my period, and there was some up my nose.
What the heck? Honestly, how much is that people don't know what that is? Like, how does that even happen? Do you know what? I actually saw a thing, and I don't know if this is right maybe to say, but it spreads as like cancer can. Like, that is the severity of endometriosis, and people don't know, especially, let me just add in, men just think you're talking about your periods, and you're like, no, it's not. It's a whole body condition. It's a whole body disability, actually. It can be a disability, it can be a chronic illness, but for you it's a chronic illness that you've lived with for years. And it's up your nose. People wouldn't think, I'm having a nosebleed. Do you know what I mean? How does it get there?
I know, literally about, I would say, a day or two before I started my period, I knew I would start my period because I'd have a nosebleed.
What?
And that's how, that is just that time ago, that's how I think the doctor or the specialist was like, let's look into endometriosis because that was happening. It was
Really?
crazy, yeah. With
So
it,
that
like with everything else as well, because it can be quite common for girls to have nosebleeds around the periods anyway, because of the additional,
stress body and
yeah,
blood and
everything going on with the body. But yeah, this with all the other symptoms is what kind of led them to that at the time.
wow.
I know.
So at this time, are you still fighting? Are you actually fighting for your condition in the sense of you're having to go back, you're telling the GP, listen to me, or is it more they are listening to you at this time?
At that point, because I had the private insurance, I literally got the referral, went to the specialist, had a couple of consultations. He then like did the laparoscopy, said we found a bit, and then cleared it. And then after that, I was just back on the pill. So I didn't. It
It didn't give
I
your body
didn't really.
a chance
I didn't
to.
notice that everything then settled with the pill, and it did. I didn't. I thought, well, he said it's gone. I feel okay. Like there we go.
So
That's
with that,
how it was.
they zap it off, don't they? They like burn it off, the endometriosis, when they're in there. Am I right?
Yeah, I think there's because when they're in there, they've got like tools as well. So you have a few little incisions in your tummy, and there are tools, and I think they can like burn it off, cut some of it off, maybe.
Yeah.
Like, yeah,
They like do it. They do a clear out when they're in there
yeah,
doing the.
yeah,
Like
and
they're already in there, aren't they? So they're gonna.
yeah, and honestly, he just said there's not really anything to worry about. You'll be okay now, and that was
true.
the case.
Wow.
Yeah. So
You
yeah,
get back on the pill though.
so
Now,
back on the pill, and then I was on the pill not perhaps for like another year maybe, and then we said, oh, we'll try for another baby. Didn't think there'd be a problem because I'd come off the pill before with Taylor, well, like trying for Taylor straight away.
yes.
So came off the pill, expected that I would get pregnant straight away, didn't. And then it was months, and it just months and months and months, and nothing was happening. And at that point, at that time, there wasn't like, you know what, I mean, there's some really good apps now, like on your cycle and when you're ovulating, and there wasn't anything like that then.
No.
But I could do like charts and things.
Yeah, yourself, but it wasn't.
Yeah.
Also, you didn't really talk about periods back then either.
No.
It was more of a. You didn't see, Tampax adverts on the telly. Like it's a known thing now. Like every male woman knows about periods, but like whereas then it was more of a taboo subject, really, wasn't it? Yeah.
Yeah.
So you didn't probably talk about it.
No, it's something that it didn't talk about, but also it kind of like then the issue kind of like all crept up really slowly. And again, like we said earlier, with as the pill, all the like hormones from the pill were leaving my body, this was really amplified with the so I wasn't getting pregnant, but then my periods, I mean, I had the one period I had was for 7 weeks.
Helen.
And it was heavy, like heavy. It was,
a lot.
Yeah. Oh, it was hot, and then the pain, and
living in pain. That length of time will ruin anybody.
Yeah, but then I might not have a period then for 4 months. Then I'd have a period for a month. It was so erratic, and draining. But also in this time, I'm trying for a baby as well. So I haven't got that cycle of 4 weeks and,
Right, I get you. The normal 4 weeks.
The normal ovulating and then you get pregnant. I didn't have that cycle. So then it started off with it was mostly the bleeding, I would say, at that point.
Yeah, that was bad.
Yeah, and then so I cannot even tell you how many times I've had the internal flipping scan with the
When they
going
go
in with, and
yeah.
now I'm just like, I'm used to it.
Just
Okay,
do it.
they say they've got to do it. Well, hopefully I haven't got to have any more now.
Crossed, but I
but
bet
I
you're used to, like you
oh
said, checking. Because that's the thing, right? I will say, I've just gone through it myself. And some people might be nervous with, I mean, I don't really care. I'm the same as you. I'm just like, whatever. But
yeah,
like, if someone's listening to this and they're a little bit nervous to have the internal scan, they're really gentle, and it doesn't hurt as
yes,
much as you think, and it's means
no,
to an end. Yes, it's a bit uncomfortable, and you might feel a bit embarrassed, don't you? But it's means to an end, and I would say definitely do it. Also, have your
yeah.
senior do it. It doesn't
Oh,
do it. You agree with
yeah,
that, don't you? Yeah,
so important.
do it. Like, yes, it's uncomfortable for what, maximum of about 5 minutes. Helen, would you
Yeah,
say 5-10 minutes? You
yeah,
can do it. Like,
yeah.
it's worth it.
I mean, it's not pleasant. It's
No,
not,
you don't want to
nobody
be.
wants to go.
No, and
Nobody
everyone
wants the
feels
duck beak.
nervous. Yeah, they don't, do you? You don't. It's so true. See,
Nobody
Helen
wants
makes
that.
jokes out of it, and that's what you got to do to get through it, isn't
Oh
it?
wow, you have got to do that to get
Yeah,
through.
but they've seen it all before. They see
Yeah,
a
exactly.
different one every 10 minutes. Don't matter to them. And
Yeah,
you know what? I when I went, because it was quite recent, they cover you over. They don't actually. They're not looking in there. They're using
no,
the camera and it's a big like stick thing, and it's all like very. I don't know. It's very discreet. I felt
it's fine.
actually. Yeah.
Yeah,
So do it
it's
if you feel
but
like
it is. I think for young girls, it's especially
daunting.
it's very very daunting, but so important.
So
So important.
if you think something's wrong, it's really
Yeah,
important. Yeah.
yeah, definitely.
So you're having about 20 of these scans, and then what
Yeah.
happens?
So that scan in particular highlighted the polycystic ovaries. So that's where that was initially picked up. So I have been aware of having polycystic ovaries for 20, not quite 20 years. And with that, I'd have like vile dark hair growth, like on my chin,
Random places.
oh god, like, and would come from nowhere. But bear in mind, like I appreciate that's normal now. I'm the age I am,
No.
but in my early 20s, weight gain, because it's a polycystic ovaries is a metabolic condition.
Yes.
So insulin resistance and all of that. So I'd like ballooned when I wasn't on the pill, which was really interesting because lots of people go on the pill and put weight on. That's like just a common, I'll go on the pill, put weight on.
Yeah.
I'm the other way.
Because it levels out your
because of the
hormone.
polycystic ovaries, it levels the hormones out.
Wow. So effectively the pill was helping you polycystic ovaries or that's what they've changed it to. Polycystic metabolic.
Yeah.
That's what, because it is. But so you're helping that with the pill, but it's probably masking your endometriosis. Yeah. Isn't that's about right, isn't it?
Yeah, so it was which is so I would have probably had polycystic ovaries for a long, long time. You know, when I said when I was younger and I went on the pill and it stopped all that.
Yes.
So it did. The pill really helped you with the polycystic ovaries.
Which is mad.
I know. So not being on the pill just played havoc with my body.
What is the treatment for PCOS? I don't think the treatment's very advanced, is it? I think it is literally the pill to control you.
So there's the pill, and then there's another tablet which I have taken recent years called metformin.
Yes,
which that is actually medication for diabetes.
And did that help you?
Not really.
No, I've heard mixed reviews about that as well.
Yeah,
so,
it wasn't.
It's like I think recently as well they're talking about the GLP-1s are quite good.
Yes.
I haven't spoke to anyone who's on that with PCOS, but I know there is because of the inflammation element.
Yeah.
But so you've been diagnosed with PCOS, and a lot of people do have both. By the way, a lot of people coexist with endometriosis.
Yeah.
And then where does that diagnosis come from at the same time?
No, so that's not spoken about at all. That now is like a recent thing with the endometriosis. So back to when I was like trying for Evie, found out I'd got polycystic ovaries, but was just like, okay, but you can't go on the pill because you want a baby. But then it was like years and I wasn't getting pregnant. So there's like 5.5 years between the kids. So I think I was about 2 years in, maybe 2.5. I'm
Wow.
not sure. And it was literally like, there's not really anything else we can do. The last procedure that they did with me was, I can't think what it's actually called, but they run dye. So they insert dye and they run it through your tubes, and then that can see whether your fallopian tubes are blocked, because they
Yeah.
did wonder if that was having an impact on like the fertility side of
Right.
things.
Yes.
And when they did, and that again, it wasn't a very nice procedure, but I actually think this is how I got pregnant. Not the dye didn't make me
No,
pregnant.
but I know what you're saying. The
But
flushing out of the.
yeah, so this procedure is, you almost, I can't think what it's called, but you have like a little kind of balloon blown up inside you just to stop anything coming out. And
Yeah.
then they run the dye through and you can see it on a screen.
So
So
you could see it.
I could see it on the screen. Also, sorry, I was just going to say I was all NHS at this point because I was only at that job for a short amount of time. So
I
I
was
was
going to
back,
ask you back for the
back
NHS.
NHS now.
Yes.
So they showed me that, so it's on the screen and you can see literally, the shape that you can see on a diagram.
Yeah.
It was that shape. I could see it with the blue dye, and then it just ended, didn't come out. So it went up and round and then didn't come out. And I was just looking. So they'd said to me, you'll see, because it like a little bit will come out. Nothing came out. And then on the one side, after quite a bit, I felt like I was lying there for hours, but almost, if you've got like a clogged like toothpaste tube,
Yeah, and
then you squint and then it goes and
yeah,
it
and it
comes out.
really comes out.
Yeah. So all of a sudden that happened on the one side, and they were like, okay, so there is that's like cleared a tiny little bit. There is a little bit of something on that side, but even so, probably like that's just a bit of dye that's forced itself through, because it was really funny like how it came out,
because it was almost like pushed, and it like
yeah
pushed a bit of a blockage out, basically.
yeah
You're saying almost. Yeah.
So then after that, and they don't say that you're infertile, but it was like, oh, you're probably not going to get pregnant. So I'd like come to the come around to the fact that I wasn't going to be able to have another baby.
And what age are you then, Helen? What age are you then?
I would have been about 28, 29, because I had Evie when I was 30.
Quite young to be told that you're not going to be able to have children. I know you've got your beautiful son, and you can't.
Yeah. I just didn't feel like I was like complete, and as you say, like absolutely blessed with Taylor, and the fact I've got both of them now, like it is amazing given the condition that I've got. So like I do feel really grateful, really grateful for that.
But to be told that's quite heavy at that age.
It was very heavy. And then so then there was an option to maybe go have IVF.
Right. Okay, so they give you that. Okay.
But you had to pay for it. So you could go IVF, but because I'd already got Taylor. If you had no children, you can get around. I don't know if that's still the case now, but you could get around on the NHS or so many. But because I'd got Taylor, that wasn't a thing. So I know.
Well, you're limited to a child because that's crazy, isn't it?
Sorry, I know.
That's mad.
It was quite. It messed with my head quite a lot. It was
like the mental health side of it.
And also I felt very much like there's something wrong with me. I can't have it, and
you're not
I can't have another baby. It was horrible.
All those thoughts, like you can't do what a woman's body's meant to. Like it's all internal, of course, and no one's saying that to you. But you're thinking, what's wrong with my body? Why is it not working?
Yeah, exactly. So anyway, I was going for the consultation, like just to go and see what it was about, and we were booked to go for that on a Monday. And then the week before I'd felt a bit weird, and on my way I was working because I was used to take Taylor to school or pick Taylor up from school, I started work really early. So I remember going to work the one morning about like 6 o'clock, and I have to drive past the test, the big Tesco at
Yeah.
Burntree.
Yes.
And I thought, I feel weird. And I went and bought a pregnancy test, and I got to work and I did the pregnancy test, and I was pregnant. And that was on the Friday as I was going for the IVF consultation on the Monday.
Oh my God.
I
That's
know.
So do you think by having that dye push that little bit through?
It was about a month after that, after having that done.
Oh my gosh. That is incredible, isn't it? And so at this point, when you're trying to get pregnant, is it called, was it called pre-contraception counselling, or are you consultant led at this time? Like, what
So
is
there
that?
was no counselling or anything
No.
like during the time of
Okay.
trying.
Yeah.
But then as soon as I got pregnant, because not necessarily because of the problems that I then got, but because of what I went through with Taylor, I then was consultant led. So I was classed as high risk because of what happened with Taylor.
And that's because of the birth with Taylor,
Yeah.
right? Is that right?
Yeah, the pregnancy and birth with Taylor. Although I have to say, then I mean, we laugh because I'm like, I've struggled so much, and then Evie's pregnancy, even her birth, it was an absolute dream. But I was in a real positive headspace of this is going to be fine. Like I need it to be okay. I've had a really horrible experience, rough time up to getting pregnant. I was like, right, come on. And you know what I'm like positive mental
I was
attitude.
just about to say, if you don't know Helen, she is one of the most positive. And I've found this with people who are chronically ill, right? I don't know if it makes your tolerability or something, but you take the positives because you've been so poorly and so ill and not everyone sees it. No one.
Yeah, I don't show it very much.
No, neither do I. I hide away. I'm like, you can't see it. And we're very good at being smiley and happy. And Helen is so contagiously happy and just a beautiful soul. That's why we click. You were so
Thank
lovely.
you.
And that positive mental attitude gets us through.
Yeah.
Sometimes, because the times where you're in bed and you're in pain, like in so much pain, I bet you were just thinking, I just need to get through this time. And as you said, positive. Is that something you'd advise people if they're going through a really hard time, like really trying to find?
I would advise it, but I also appreciate that it, like, people can just say, oh, just be positive, just be happy. You can't it does take years of like mental resilience, and
you're proof of that. You're proof of that, because you're on about trying for a child we're talking 5 years. That's a very long time.
It's about 3 or 4 actually trying, but that's
a lot of people give up at that time. And I think in this day and age, we're so used to getting everything at the click of a finger as well. Like, you want it here, now, look, get it. Whereas it can take years, and you're proof that it's the most beautiful, blessing thing that's happened to you. Like, you're giving people like me, or you give people hope, I think. And that's a really amazing thing for sharing your story. That makes sense that you do that. So you have Evie, and it's a great time, let's say. Amazing. And then let's go from there into life.
So Evie's pregnancy and birth was a dream. After having Evie, back on the pill, because straight back on the pill, and it was everything's fine.
Okay.
Then Evie was about, the first time this happened, Evie was about 3, I would say. I started having, while I was on the pill, I started having random bleeds.
Okay.
Just randomly bleed. I could, like, if I had sex, sometimes it literally
bleed.
So that like triggered something, and it was which then made me scared to have sex, because it was vile,
and it's
like
the pain as well.
So it would be painful, and then I'd have this massive bleed, and I'd just be like, oh God, like it's horrible.
Completely disabling as well. This is people listen to it. It's affecting your everyday life.
Yeah,
that's what it is. It is affecting your intimacy, your probably how you're feeling in yourself then, because you don't feel like womanly, sexy, all those things. It's not nice. And men have never had a period. It's not it's like bleeding is not nice. Like, you feel
No,
dirty. It's not. I know it isn't. That isn't. But you do feel
do
that
feel
way.
like that.
You can't wait for it to be over. So for it to be happening randomly, and as you
Yeah,
described, you're quite heavy. That's a symptom of endometriosis as well,
yeah,
heaviness. That's hard, Helen. Really
yeah.
hard.
So that was happening, but actually that was that wasn't the endometriosis. So there's something else. So
Oh God.
I went for another scan. You
Yeah.
know how I
Another
enjoy
one.
these scans. Get
Yeah.
another one. And there was a like a little growth. They call them ectropiums. Have you heard of that? It's like a
Never
cervical
heard.
ectropium. So it's basically like a little growth that comes, I think, on your cervix. And what was happening is like that was rupturing, and that's what was creating these
The gush
heavy
and the bleed.
bleeds. So
What?
I had that. They found that, had it, and that was like quick procedure, cauterize it off. God,
Yes.
like I mean, it took a while each time. So I had this 3 times, and it happened. So that happened, and then it happened again. But it was like 2 years in between each one. So that had happened. I'd have it removed.
It'd be okay for a year. So
Then almost 2 years, and it would start again. And then, of course, you have to go through the whole process again. So by the time
because
I'm
it is
actually
wore off.
having the procedure done, it's like it's bleeding a lot. So, and then the second time it happened when I
Is
spoke
it
to the
painful? Sorry, Helen. Is it pain?
um,
Not like you endo.
it's not like endo, and it's not really, in comparison to everything else, it's not that painful. It's just the heavy bleeding of it, which is the
But
thing
that's
with that.
so comforting and horrible
Yeah.
anyway.
So the second time I went, the consultant said this, because I was on microgynon pill at this time.
Yes,
He
yes.
is.
We've tried that one.
Giving that one a go.
Yeah.
So I was on the pill, and through all of this I was on the pill, and the second time I went, he said, I wonder whether it's the pill, the hormones in the pill and polycystic ovaries and everything that's creating this. I said, okay. So he removed that, and he said, if it happens again, it's likely to be in another 2 years' time, because it kind of builds up.
There we go.
And at that point, we probably won't remove it. We'll ask you to come off the pill. I said, okay, that's fine. So it did happen again, went in, and they said, yeah, we're not going to remove it. Let's just try coming off the pill, which really scared me, because I knew all the problems I had when I was off the pill with Evie. I said, I cannot
You
have
don't
nothing. I
no,
need something.
because you know your own body. At this point,
not
you know
even
your own body.
Yeah, not even like for contraception
No
purposes, like for my
pain.
hormone levels, and I just thought the thought of coming off the pill scared the life out of me, because
Yeah,
I knew what it was going to go back to.
brings hell.
Yeah.
Yeah, for you it does.
Yeah. So they suggested the coil. So to have the coil fit.
Okay. The
So,
hormones in it, is it the hormone one?
yeah,
With progesterone in it, is it?
yes,
Yeah.
that's it. So there's not estrogen, there's
Yes,
progesterone.
yes, the one, isn't it? Yeah.
Yeah. So I had to come off the pill. I'd got a bit of time, so then it started again a little bit, but then had the coil, and then I went back after 6 months, and it had regressed. So it was the pill that was causing
What the
that.
heck?
I know.
Oh my God! If
So
people knew, that's mad.
So that was amazing, but then I couldn't ever go back on the pill again. They said I wasn't allowed to go back on the pill, which, I mean, even now, like it was like a comfort blanket, because it stopped everything
And
being,
you were in so much pain with it. Like for you,
yeah,
that fear. If people have never been in constant pain, they'll never understand the fear of being in that. If you can, like, what I'd give to wake up without a migraine and not have a pain in my head, like that you would give your right arm, and I'm not kidding. Like, genuinely, isn't it right, Helen?
yeah,
People with chronic illness often live in chronic pain, so the fear of having to go back to that, I can really relate, and I'm sure a lot of people can, because it's actually scary, because you wouldn't want to do that out of a choice,
no,
but you didn't really have much choice there, because
no,
You've got,
because my body was like rejecting it, which is what so it was creating that. So I had the coil. I'm trying to think of the time frame of this. This was about 4 years ago.
okay, oh, so it's quite recent then, yeah?
Yeah.
So you're 42, and look how long it has taken you to get, and you've dealt with problems with your womanhood, should we say, period bleeding, for this amount of years. Like, how draining is that?
It is, but it's a bit like you've just said about the migraines. Although you've just spoken about it like that, we can have conversations and you will just go, oh, I've got a migraine today, like it's nothing, because that's your normal.
You are right. It doesn't mean they're any less painful. It means we are used to it and we normalise it.
Yeah, you do. Just you normalise it. And I've found over the last few years, I almost didn't know whether I was in pain or not, because it was so normal.
Oh my God, yes, I can relate. And then
I don't know how to explain that any better, but
no, because in the morning I try to do like check through my body, like me and you, mindfulness and stuff. But I almost think is my brain. No, and that's actually a thing, by the way, Helen. It's a full-on thing because I've read about it. You normalise the pain, but you gaslight yourself into thinking you're not in pain. So it's almost, because obviously pain and stuff, it does start in the brain. That is, pain receptors. But you gaslight yourself, and then you think, well, I'm able to go to work. I'm able to look at the screen. Am I really, like for me, sorry, in the migraine sense, am I really that much in pain? But it's not that. Our brain gets used to the pain levels. But then it'll come to a point, I don't know if you found it, where you completely crash and you're really ill.
Yeah, and I think that's when I've had the flare-ups, the endo flare-ups, is that, so you kind of like just cracking push. Yeah, and then there's then you just wiped off your feet, aren't you? And you can't.
And I think that is because endometriosis as well, fatigue's a really massive symptom, isn't it? And the word fatigue gets thrown around a lot, but it is completely debilitating. Like, it's, people don't get it to that. If you obviously, and we're trying to educate people, so it's like your body's so tired, you physically can't go and do things, and you're a mom at this point as well, so children are number one, you're secondary in a way, you're in a new relationship as well, so all the way through this time it's sort of like you're probably pushing yourself a bit too much, maybe at that time. So with that, obviously, let's skip forward. We haven't been able to dive into it too much, but you've just had your operation probably about a month ago we are now?
8 weeks.
8 weeks.
8 weeks tomorrow.
Wow.
Yeah, 8 weeks tomorrow.
So had a full hysterectomy, didn't you? And
so I had a total hysterectomy with my ovaries removed as well.
Okay. Because there was the option to have them stayed in, am I right? Yeah.
Yeah, they could have kept them in. And I'd got polycystic ovaries, obviously, so I was thinking, I don't really want them in. And I think because of the point that I'd got to then, with the pain, the pain was literally at the point that I then went private with it. The pain was so debilitating, and so it was like I'd get shooting pains all the time. So when you're on the coil, you generally would get to a point where your periods stop.
Yeah, I was about to say.
But I still was having 2-week periods
through the coil,
and random bleeds as well. But I could have like 2-week periods, and bear in mind, how I love like my villa days and
going out
and all of that, and going out with the boys. I am literally one of the boys when I'm out with them, and
we both support Aston Villa, by the way. If you don't know who we're on about there, Aston Villa, the football team, and that's how I know Helen, really.
Yeah, through your dad and Drew, isn't it?
Yeah, it is.
But yeah, so it was getting to a point, even on we've been fortunate to have some brilliant away trips and European trips, and I can, like, I wake up in the morning there and I'm just like, my first thought every morning was, am I on my period? Am I bleeding today? Every time I go to the toilet, check in, is there anything there?
And that in itself, if you've ever been in that situation, it's really draining, because I was on the pill and I end up spotting through it and stuff and bled a lot. It's really draining because you're constantly, also, with the football, it's a very male dominant area. So
Yeah.
you're thinking, I'm just checking if I'm on period, have I leaked? Because you were heavy
Yeah.
at that point
Yeah.
as well.
Yeah.
Oh,
And then this, like, the severe pain was coming in so I probably had about 3 years of this. I said the pain before with endometriosis, but I didn't have it dragging. It was like this shooting pain, and then it'd go down my leg into my big toe, like sciatica, and it was horrible. But again, you just normalize it. Like, I had no time off work sick. I just, because
you're a warrior. You're a warrior, you are.
I've had some time off now. No, it's very alien to me.
Yeah, well, you needed it though. Your body needed the rest.
I know. So anyway, like, fast forward, I had a laparoscopy last September.
Yes.
And so this took 3 years then to get to the point of, and lots more tests, lots more scans.
But you're advocating for yourself though now, aren't you, Helen? Like,
yeah, and
you're
like really
them.
pushing through, and I just thought this has got to, something's got to be done, because I can't go back to my fail-safe being on the pill, because I can't go on the pill.
No, and also, yeah, you're right, and also at this point it's completely consuming your life.
Yeah, and the coil wasn't. The coil was there, but it wasn't. I mean, what I would say is the coil was preventing that like 6-8 week bleed, and it was just a 2-week bleed. So it I mean,
just you know what I mean? Just bleeding for 2 weeks. But joke aside, that's your reality. Again, we normalise it. We're normalising it.
Yeah, exactly.
And that's why.
So I had the laparoscopy in September. The consultant who did the procedure wasn't my consultant, so I then went back to my consultant for like the follow-up, who said, like, didn't really touch too much on the endometriosis, but just said the options now you've got are an ablation, which is where I think they do like a whole sweep of your womb to remove the lining.
Yes.
Or a hysterectomy. But if the ablation doesn't work, your end thing, you got to have the hysterectomy anyway. So it took me quite a long time to kind of get my head around it, because I was still, this was like in the November when I went back to the consultant.
Yeah.
So I was just like, right, give me all the information for both. I'm going to go away. I want to speak to people.
Been through it, or family, friends,
have Christmas. And I was still like off the back of having a laparoscopy, which that procedure in itself is
recovery.
Well, it's keyhole surgery.
Yeah.
So that wasn't very, and I was still, getting over that. And I thought, I can't do anything at the minute. I just need to get my head around it.
The mental.
I knew I needed to do. Yeah, I needed to do something. So anyway, got Christmas out the way. So this is, I'm talking Christmas now, just gone.
Yeah. 2025, aren't we?
Yeah. Came to the decision that I was going to have a hysterectomy. I spoke to quite a few ladies in my life at work, friends who either knew of people or who had been through it themselves, and 100% the hysterectomy was the right idea.
Yeah.
And then I was so fortunate at work that it's private healthcare, like, it's not free, and it's not even like funded by the company, but our benefit is that they take pre-existing conditions,
and for you it is.
So so I could literally join. I joined at the start of March, saw a consultant in March who, because I'd had the referral from my consultant, was like, that's fine, I can do it, and then had to have another scan.
Oh, you and these scans. You're just being selfish having all these scans.
I've taken all the scans.
Yeah,
so and then my procedure was booked in for the 30th of May.
Which is mad. And you've had, we're joking, but probably in your lifetime about over 50 scans probably. What were you thinking going into the hysterectomy? Like, how are you feeling? Like, it's the chapter closed? Like, you're thinking, please God, like, come on, work for me after all these treatments?
Yeah, again, like, so I'd done so much preparation going into it, speaking to people, ChatGPT was amazing, like just for information.
Yeah, knowledge is power, and you have to be your
Yeah,
own. That's one thing I've learned about chronic illness. You have to be your own advocate, and you have to
yeah,
learn about these things, because no one's going to baby feed it or feed it you. They don't give you that much information at a gynecology appointment.
no,
I found that. I've actually spoke to Helen about my options for a hysterectomy, because she knows more than my gynae's told me. But that, you know, their job, they see a lot of people with the NHS.
yeah,
They're not, you know, they do see a lot of
yeah. And I am not
we're not poo-pooing that or anything, but
no,
it's a bit.
not at all. But I had, you know, I'd come to the point that something had got to be done. I was really positive going into the procedure. I was
Yeah.
actually quite excited on the day, because even I'll play it to you, or I'll send it to you. I did a little video of myself in the morning before I went to hospital.
Oh, please do.
And I will. And John was still in bed because it was really early, but I was allowed a coffee before 6 o'clock. So I was like, you stay in bed. I'm going to get up. I'm going to go and have a coffee. And just I put a candle on. The girls at work have bought me a beautiful candle. Don't, because I
Why you might be crying.
don't make me cry. So I was listening. Not listening. So I was sitting there and I was like, oh my God. And I'd got the pain, because this was at the point, it started off being before my period, then it was after my period, then it was any time.
Constant.
So I was sitting there with this shooting pain, and I just thought, I'm not gonna have this again. Like it's gonna go. I'm not gonna. My last period was amazing as well, so I thought that's it. Well, apart from thinking there might be some in fact, I did have a little rogue bit, just a little treat before the op.
The end thing, but it's like the end of your whole life, and your end of, like, it's quite monumental, really.
Yeah, and it was like, honestly, for me, it was like my identity of this is what's normal for me. And
not normal at all, by the way.
I look back now and I just think, oh my goodness. And bear in mind, because I had the total hysterectomy, and so that's the cervix removed as well. So everything's gone, and my ovaries.
Your womanhood gone, basically.
Yeah, straight into, so there's a treat, straight into surgical menopause. No gentle perimenopause coming in.
Here we go. Here's the big. It's like a punch in the face. Doing it by halves.
But I think I'm doing all right with that. We can do another one on that if you want, because
I'd love to do another one about that.
I've got like HRT stuff that I can talk about, which I think we're doing okay.
Yeah, I'm about to say, you seem, obviously you're positive and you're happy, but would you mind if we finish on what they actually found? Because you had your consultancy on Tuesday, am I right? Was it this week?
Yeah, so I had my post up on Tuesday this week. Sorry. So he said the procedure had gone well. It took a bit longer than it would normally, because on my left-hand side, which is where I was getting all the pain, the endometriosis was like around my ovaries, and there was a lot of scar tissue from the previous, and so like from 20 years ago. So I'd got the scar tissue from that, and then I'd got the endometriosis, which it was kind of like on my ovaries, and it was like I think you said earlier, like a web, like a bit of a spider's web around. So that was removed, and it was all removed fine. It just took a long time
because of web.
And I think the removal of your ovaries in the whole procedure is like the tricky part anyway.
Yes.
But the surgery in itself all went fine, just took a little bit longer than they expected. And then everything goes off to pathology, and then you like their feedback if there's anything to say. And he said that when they opened up my uterus for the in pathology, there was a fibroid in there as well, which even when he removed my uterus, even though he said it was like it was a bit inflamed, because there's like that wasn't really surprising with the inflammation and everything going on, but I was constantly bloated as well.
Yes.
It wasn't until they actually went into it and found that there was a fibroid in there as well. So that's what and that was all like pressing with the endometriosis on my left-hand side. But it's gone.
It's gone.
It's all gone.
Which is incredible. Like, but to hear that, it wasn't in your head. That's one thing you said to me.
Mm.
You said, oh, just like the validation, but the fact that it takes that long for everything, like your story, it's just giving me goosebumps that they've found. It's horrible, really, that you've gone through your whole life for that and they didn't know. So we're proud and happy that there's different steps that have been like taken to change that. Also,
Yeah.
I'm so happy that you're sharing your story, because someone listening to this will definitely resonate and hopefully take joy in that you've had your children. There is hope. It's not linear. It's definitely not a linear thing, especially with chronic illness. You can be better down, up and down. But if there is one piece of advice that you'd give to somebody who is struggling with the periods, heavy bleeding, you know, if they're starting out at their journey of a bit of the confusion, what would the advice be?
I would say it's not just your period. If you are having symptoms that are debilitating, yes, like you know what period pains are. If it's more than that, if you're having excessive bleeding, go to the doctor straight away, because it takes such a long time, but just keep pushing. And if they say to you, oh, we can't do this, push for a scan, push for a blood test, push, like just keep going, because you know your own body. And when I was in with the surgeon on Tuesday, and my mum was there. I mean, I don't know how I held it together, but when he said, well, I was so full, and I just said thank you, because you've just like validated all of it. So I know, like I said to you, I wasn't going mad, but I had normalized it all, and it wasn't normal, and it affected my life like
up until 46 every day. And that is the thing with chronic illness, disabilities, anything. It's sad that you have to do it, but you have to be your own advocate, don't you, Helen? And you are in resilience, advocating for yourself, and just being a badass bitch. That's what you are. That's what you are. And I think if it's okay with you, I'd love to have you back.
Yeah,
and we'll
definitely.
Talk about post-op, maybe give it a couple of months, see how we go on the HRT, and see. And I'm sure the listeners would love to hear the other side of it, almost through the power and the decision that you've decided yourself, because you've taken your power back now, I believe. I feel like you have, from your condition, and I'm happy to see. I'm so proud of you, and to see what the future's going to bring for you as well. You're amazing.
Thank you. But I was just going to say as well, the surgeon, but like before, so when we're having the consultation about it, and he said to me, like, what do you hope to achieve? Like, what's your end goal? And I hadn't even thought about it, and I just said to not be in pain every day, like, and I didn't even realise I was in pain, like, but I was like, I can't cope with this pain, like,
it's completely debilitating. Like, that's made me like, that's what I wish for. I'd wish to wake up not in pain, like and I know there's hope out there, because
there
I'm not saying like definitely, like, I can't have my brain removed, I know that, but you've got to try all these treatments to get there, but keep trying, because something will work.
Keep going. And while I've had major surgery, so I have experienced in the last 8 weeks a lot of pain, but to know that I haven't got the pain going forward now,
you can deal with it. It's like a broken arm or something. You can deal with it when you know it's going to end. I think with chronic illness, it's the surprise of having the pain. You don't know, is this, say for me, is this migraine going to last 2 hours, 3 hours? You don't know. Like, is your bleeding? Like, you won't have that anymore.
I know. No more bleeding. And I thought the other day, I went to the toilet, just went for a wee, and I came downstairs, and I thought, oh, I never checked to see if I was bleeding. Like, I'm just, it's amazing. I know, it is, honestly, it's amazing. And I'm going away with Evie.
It's going to be,
and I just think I haven't got to take like a suitcase full of pants, tampons, tablets, worrying when I'm by the pool if anything, you know.
You can.
I'm so excited.
That level of anxiety will go.
Oh yeah, massively.
Well, thank you so much, Helen. I've loved listening.
You're welcome.
To you, and I know everyone else has loved listening to you too. And I think we're going to do another one.
We'll do another one.
Yeah, is that okay?
Absolutely.
Your story is literally one of like resilience, inspiration, keep pushing
Thank you.
advocacy. So thank you so much. I have been Simone. That has been the beautiful Helen. And thank you for listening to Cool and Chronic with us. Bye-bye.
Bye.